Hello, I am Dr. Chandrika HS, practicing as an obstetrician and gynecologist at Chirag Hospital, JP Nagar, second phase. Non-negotiables is one thing is exercise. Exercise is not negotiable. I am mother, I am very busy, I have to look after the family. So many people they tell I am doing the whole household work, so I cannot afford to do exercise. What I advise the mother says, doing exercise is different from what normal activity you do in your housework. See, what you do in your housework does not give uniform exposure to all the muscles and the bones. So that is the reason what I tell is you should better relegate the work to somebody else and you try to get time for yourself for exercise. So that is one way, that is best way of doing. So you have to go for exercise other than your routine household activity. That is my advice for elderly mothers. That is what is called as non-negotiable. You can't negotiate telling that you are having some other work. So you have to take care of yourself. Matlab, you have to give some extra time for yourself to do some routine exercises, which is a must these days. To a certain extent, yes, because these hormone changes will produce some physical changes in your body, and not that all hormone changes that produces physical changes needs to be replaced. That is the reason you have to try to manage your life depending on the change that happens in the hormones. And when the change that happens is very drastic and it is unbearable for the mothers, and if you are not able to tolerate those symptoms of hormone deficiency, those are the times when you have to very carefully, with the advice of a proper doctor, then only take hormone replacement. And there is no need for you to suffer. There are so many medicines which have come now which are not hormones and which are giving very good relief from this hormone deficiency also. So you can go to the doctor and get yourself relieved of those problems. And sometimes you may need to take hormone replacement also. There are so many hormones which are very safe regarding the bone health and regarding the other metabolic diseases. So those things you have to take care by the advice of your doctor. Yes, that's what I tell about ladies. In general, what we have seen in the world is, that is especially in Indian ladies, always the ladies put the family first. They will not bother about themselves. They, to the extent possible, they avoid what is to be taken care about themselves, and they try to be doing everything for the family. And they, by the time they notice, it is irreparable. So this is wrong. So you have to take care of yourself also. If you have noticed some problem with you, it is better you go to your doctor and you let out all your problems, so they'll handle it. And if it is a major problem, you have to handle it in a stage where it is repairable. Suppose you are having some mass, example I am telling, suppose you are having a breast mass and that may be a cancer, and you will think, oh no, it's not, I don't have time to attend the doctor, I don't have time to. So that time you will think about your children, he has to go for exam, he has to go for some interview, and you will be bothering about only those things. You will be bothering about your husband, and by the time you realize and you will go and meet your doctor, it will be a very late stage, and that if it is a cancer or a malignancy, it will have advanced to such a stage that it is uncurable. So I feel that it is first better family first is a wrong decision. If it is a proper family, the family people should take care of their mothers in such a way that they don't do this and they don't land in problems. Because if they land in problems, ultimately it is your whole family that is suffering, and you may lose your family woman forever. So please don't do these things. Please always try to take care of your mothers also in an equal way. You can try to balance the time, and you can afford to take her to the doctor and avoid such catastrophes. Top hormone friendly habits. What is the thing is proper diet. If you take proper diet, you should know which these things happen. What see, you should not take junk foods and all those things, because they'll have preservatives, and preservatives can have effect on what natural hormone you have. So try to avoid junk food, try to avoid overeating, try to avoid very high calorie diet, and always try to take a simple diet. And you have to try to take diet in such a way that you get all your vitamins and minerals. Minerals are also very important these days. They are all very small quantity that is needed. But if it is continuously getting deficient, it will have effect in your body. So the way to take care is you try to take a proper diet and try to take a proper exercise also. Your body should have, it is not just eating, it should have activity also. And whenever you do proper activity, then your body will be balanced, your muscles will be properly developed. One more most important thing I would forgot to tell you is in menopausal age, it is a time when sarcopenia happens, because if you don't be active, your muscles start becoming weaker and weaker. So for that sake, you have to continue to do some muscle activity so that your muscles will not undergo weakness. Means once it becomes very weak, it is very difficult to revive it. And if your muscles are very weak, that time your body will become routine walking also will become a problem, balancing will become a problem. So these are all the things that you have to be wary about. So you have to take proper diet, proper exercise and proper sleep also, because continuously losing sleep will have effect on your routine psycho. Morning, if you are fully always not having proper sleep, you may not be proper with your family, you may not be proper with your society, and that may affect the whole society. So try to get balance of proper nutrition, proper sleep and proper exercise also for to maintain a normal healthy body.